My Woolner project involved working at the Toronto Zoo, looking at the interactions between lemurs, other animals, and people in the shared environment of the zoo. Hi, my name's Travis Steffens. I'm in the Department of Sociology and Anthropology. I teach Introduction to Biological Anthropology, a fourth-year seminar course called Primates, Peoples, and Pandemics, and I also teach a public anthropology course, a second-year anthropology course.
So what does One Health mean to you?
One Health to me is the realization that animals, humans, and their environment are inextricably linked. So we have to understand any one of them, we have to understand the relationships between them. To me, primates are a specific and interesting case for One Health. We are a primate. We're related to every primate. Our closeness to them matters. You know, we see monkeypox in the news. That's because of our relatedness to primates. There's other zoonotic diseases that are important from a perspective of being a primate. But it's not just zoonotic disease. We need the same types of things that other primates need. So where we live is the types of places other primates like to live. We don't see that in North America, but most people on the planet live close to a primate. And so we have to remember that. We're sharing their habitat, we're sharing their environment. And leveraging approaches like a One Health approach is going to allow us to figure out how to coexist sustainably.
Can you tell me a little bit about your current research right now, Woolner related, and then any other projects that you have working on right now?
Yeah, we with the Woolner project, myself and Raquel Archie did a project at the Toronto Zoo, and what we were looking at to see were the interactions between lemurs in the enclosure, the other animals that are also in the enclosure. There's tortoises there and some birds. Animals that can come into the enclosure, things like sparrows and rodents and such, and the people that engage with lemurs either as zookeepers or guests within the context of this captive environment that actually is interacting with the external environment. So to see if there's any potential for zoonotic disease transmission and to understand the interaction points in this scenario.
And how does your research relate to One Health?
So I try to do a One Health approach to all my research, and so part of my research is conservation-based, looking at how to protect lemurs. Lemurs are the most endangered animal in the world, and they're endangered because of people, but they're also going to be saved because of people. And it's because people share the environment with lemurs, and those interactions matter. And when we're looking at the project at the Toronto Zoo, we can apply some of those results, the understandings of those interactions to the interactions we see in Madagascar as well, and in hopes of finding solutions that help both lemurs but also the people that live in the shared environment.
What One Health disciplines do you draw on?
Well, I come to One Health from the outside a little bit. So I'm an anthropologist who's trained in conservation biogeography. So I leverage those, spatial ecology. I leverage tools from anthropology as well. And then I need to collaborate with others who we had a project that involved nutrition. We're going to need understandings of epidemiology and zoonotic disease and so infectious disease knowledge. So I draw on quite a bit of stuff. Even with regards to the conservation side, we're drawing on economics and business, and there's no limit really to what we're drawing from. It's whatever the question dictates for us.
How has the Woolner Studentship helped you in your research?
Yeah, it's been amazing because, first of all, we've been able to get two really amazing undergraduate students involved in my lab who've done research that I could never have done on my own. They brought expertise and an eagerness to try new things that was fantastic. It allowed me to expand the program because of that, and allowed me to, because of COVID, I wasn't able to go to the field. So one student was able to use data we had already collected, and another student was able to use to collect new data, and we were able to start a new component of my research program at the Toronto Zoo. And that was really beneficial because now I can connect my world here in Ontario to Madagascar a little bit more cleanly.
How has your research focus changed between your Woolner studentship in 2020 and 2022?
Yeah, so in 2020, originally the Woolner student was going to go to Madagascar, but COVID happened, so we couldn't. I run a charity, and so that charity generates a lot of data through various means, through surveys and lemur monitoring and such. And so that student took the opportunity to pivot and switch gears and to analyze data from our livelihood surveys. And so that was a very sort of data-centered project where she was just analyzing existing data and organizing it. And the current project, although Madagascar opened up, I still wanted to make sure I had something here in Ontario, and so that I wouldn't have that situation that I did with the first student. And so then I approached the Toronto Zoo, who was eager to do this type of research. They're really keen on One Health. And so because I had a second opportunity with another Woolner student, I was able to engage with the Toronto Zoo, establish a new sort of research partnership that's sort of starting up now, and conduct research at the Toronto Zoo.
Nice. And did you want to talk about your the charity that you have is it Madagascar?
Yeah, so the charity is called Planet Madagascar, which is here in Canada, but our almost all of our activities are in Madagascar. And we do conservation, community development, education, and build schools and health. Also, basically, I talk about it. We do everything the community needs to improve their own livelihoods while protecting lemurs at the same time. And so if that means the community requires a better road into their community to achieve that objective, then we're a road building organization. If the community needs better healthcare services, then we try to provide that. And we do this in collaboration with the community, so it's very consultative. But the focus is improving people's lives while protecting lemurs.
Okay. And how does education look to Planet Madagascar? How do you educate?
So we do a number of initiatives. We do education geared towards adults. We do, sometimes it's just information like dissemination. So we try to inform about the risks of fire that are in the forest that affect lemurs and people. We sometimes talk about zoonotic disease risks. Lemurs are important seed dispersers, so we educate about that. And then we have projects set aside or targeted for children, which are more just in getting them engaged and excited about why lemurs are super cool. Because to them, in many ways, lemurs are kind of like squirrels and raccoons. But to us, they're so unique. And once they realize they're only found in that area, they also agree that they're cool and interesting. But then we go a step further, and we're building infrastructure. So we've built a school so that there's access to education for people in the communities that we work with.
So was there anything that you wanted to share about your trip this year from Madagascar, or
Sure.
last year or anything?
Yeah, Madagascar was great. This year we saw so many incredible things. I work in the same area the nonprofit works, the charity I run, so the research is done in the same spot. And we saw a lot of potential One Health interactions. There's lemurs that come into the community. This is a little gross, but one of the lemurs in the forest, so further from the community, was consuming maggots from human feces. And so there's a huge potential for zoonotic disease or reverse zoonotic disease interaction there. Dogs and cats are interacting with lemurs. Cattle interact with lemurs. And so the One Health implications of this are very important. And so we got to see that in person. It's something that I've noticed in the past, but we just got to see more of it on this particular trip.
And why lemurs?
When I was 8 years old, I wanted to be a monkey,
Yeah.
and that was hard, and I realized I would rather study monkeys. And as I was learning about primates, I wanted to understand where they were and why they were there in the context of human disturbance, because primates are one of the most endangered animals. Lemurs are the most endangered animal we measure. And lemurs are the perfect animal to study habitat loss and fragmentation and such. But they have animals that are like crazy. There's animals called shafakas, indries. They're just such weird things that I had to go there to see what a shafaka or an indri looked like. So I was kind of just interested in them originally because of how cool they sounded.
I asked this to Raquel, and I'm going to ask you as well. Do you have any fun facts about lemurs that you want to share?
Well, this is something I should have known because I'm a lemur expert, but I remember I did a talk with the zoo about a year ago, and someone asked me, how many rings does a ring-tailed lemur have on its tail? And I was like, I wasn't sure. They always have 13. It's never 12. It's never 14. It's always 13.
Yeah.
no idea why, but it's always 13.
Yeah.
So that's one of the fun facts that I recently learned, even though I should have known better.
Okay. Do you have any outcomes or results that you want to share from your studentship this year that you can elaborate on?
Yeah, it's still preliminary, so we're still sort of figuring out what we learned. And it was really a survey. We were trying to find all the information we could to start analyzing what are the real risks to lemurs and people for zoonotic disease transmission. The zoo already has a very good understanding of this. We were looking for the stuff that they may not consider. That's why we leveraged some of the video and we leveraged spending time with the lemurs at the zoo to watch, say, some of the birds or such coming in. And what we found was that animals interact with lemurs from outside the enclosure to inside. So when you're considering the risk to lemurs or to people, because lemurs can transfer things to people and vice versa, we have to consider the external environment as well, not just the enclosure and the interactions within it.
And so from the research that you gathered this year, what do you see yourself doing in the future with the research?
Yeah, so to me, this is the foundation of what I hope will be a long-term partnership with the Toronto Zoo. So we will look at all sorts of elements related to One Health, but we might look at, how the interactions with lemurs affect mental health of guest visitors. We could look at how zookeepers who work with different primates have different health or mental health outcomes. We can look at, from the lemur's perspective, is being on exposure, like being on exhibit, stressful or not stressful. Some of these questions have already been addressed to some degree outside of this context, but they haven't done it while looking at it from a One Health approach, where we consider the whole system. Another element I'm very keen about is the zoo is situated in a conservancy which is adjacent to farms and beside a major metropolitan area. So the interactions of the people coming into the zoo with the lemurs is unique. You can have a zookeeper that lives on a farm and another zookeeper that lives in the city, and what they bring into the zoo and what they bring out is very different between those two types of people.